It is a great pleasure to introduce Alina Latus. Alina is based in Hamburg, Germany, and is currently a product designer and digital expert in the healthcare segment. As founder and CEO of Hope Applications, she specialized in patients management systems in the field of fertility treatments. Hope Applications is the exclusive partner of MedITEX IVF and provides a digital solution on the patient side. The topic of her presentation is the future of digital patients management. So Alina, please go ahead.
Thank you. Hello. So today I would like to talk to you about patient management in the digital era. It was said, I'm Alina Latus. I'm a digital product designer based in Hamburg, Germany, and I'm the founder of Hope Applications. But I'm also a former patient who underwent fertility treatments over the course of 5 years. And I don't want to keep you in suspense unnecessarily. Yes, I'm also a mother of 2 beautiful boys whom I conceived with the help of modern medicine. Unfortunately, that was the only modern thing about the whole process. Because in those 5 years, I collected a large amount of paperwork from my doctors, everything from results, documentation, treatment plans, correspondences, invoices, contracts, information sheets, and much more. And I can tell you, my early adopter digital-driven personality suffered a lot. So I decided it was time to disrupt the market on patient management and fertility treatments. My team and I spent 3 years in developing an app that brings together all the information and documentation created during treatments into one place, the pocket of your patients. But that was not the only outtake. In the process, we discovered some useful insights on the clinic side as well. In our research, we discovered that treating one patient requires a host of resources. It's time, money, and personnel consuming. So we asked 15 clinics in Germany the following questions. How often and for how long does a medical assistant and/or biologist need to talk to a patient on the phone per treatment? On average, how much time does a biologist spend on preparing and printing documents to hand out to the patient per treatment? How much paper and printer cartridges do you need to, on average per year? How much time does a medical assistant spend per treatment preparing and sending letters that may not be emailed? And how many letters are sent? How many contracts need to be prepared per treatment? And how much time does it take to get all contracts signed, collected, scanned, and filed properly? And I can tell you, the answers were almost the same. We discovered that for 1,000 treatments, medical assistants spend 750 hours preparing and sending letters and talking on the phone with patients. And in addition to that, they spend 500 hours dealing with contracts. Biologists spend 410 hours preparing and handing out documents and talking on the phone. 60,000 sheets of paper and 40 printer cartridges are used per year. And the end result is a cost of 35,000 euros for 1,000 treatments per year and clinic. That also means that a clinic pays 35 euros per treatment for a patient. And in fact, statistics tell us that every patient needs on average 2 treatments to get pregnant. So to be precise, clinics pay 70 euros per patient just to organize and manage their treatments. And of course, most clinics do far more than 1,000 treatments per year. So with this being said, let's talk about the upcoming generations of patients. Your current patients are early millennials and late generation X. That means that most of your patients are still a bit clumsy with their digital devices, even though they already use their phones on a regular basis. But this will already change in the next few years. Other than the early millennials, the late millennials and Generation Z are completely depending on their phones, laptops, and tablets. In fact, they are the generation that never knew life without Google. This digitally native generation is social media literate, always on, and hyper informed. Today, Generation Z is the world's largest generation cohort, accounting for 1/3 of the global population. They have the fastest growing disposable income, which is expected to reach $33 trillion over the next decade. So no matter what you think of this generation, your business future depends on them. And if you're interested in the satisfaction of your future patients, you have to understand their needs. They're not only interested in the end goal, which would be a baby in their arms. They want the whole process along the way to feel effortlessly transparent and inclusive. Giving them paper documents where they need to figure out for themselves how the treatment works is not an option anymore. With their whole life taking place online, your future patients will expect a digital solution for the organization of their treatments. They will not want a table to make them wonder if they're doing it right. They need an interactive calendar that tells them exactly what needs to be done each day. They won't accept being left in the dark depending only on your professional decision. They want to be involved in every step of the process. And yes, I know this is exhausting and annoying and it feels like they don't trust you, but let me tell you that this is not the case. They just can't help themselves. This is how they grew up. So no matter how much you try to resist it, you won't be able to ignore the shift in your patient's behavior. What you can do though is adapt to the given situation. You can accept that digitalization is not a funny gimmick for your patients, but an unavoidable future, the unavoidable future of your clinic. You can save your patients and yourself a lot of stress and pain by not only accepting the circumstances, but by being a major part in the digital revolution of patient management. And now, at the end of my talk, I want to give you 3 pieces of advice on how to do just that. First, be aware that you are the expert, not only in your professional field, but you also know your patients and the treatment processes in your clinics best. So if you look closer and talk to your employees and colleagues, I'm sure they will feed you with valuable insights about their everyday struggles. Knowing the weaknesses of your clinics is the first step towards practical solutions. Second, look around. There are very good digital products on the market already, and you just need to find out which one of them provides the best solution for your individual struggles. And if you find out that there is no current product that will help you solve your particular problems and increase efficiency, find someone who can provide you with a custom solution. Third, do the math. If a company provides a digital product for your processes, don't decide with your gut feelings if the price is too expensive. You must know exactly what you're paying if you're not using their product. I promise you will be surprised. So this sounds like a lot of work and money, but let me assure you that most of you will be happy with the products that already exist on the market. There are companies who have put a lot of time and money into developing products, digital products that will suit your needs almost perfectly. And the best part of it is they are ready to use immediately. So I hope I was able to give you some insights into the future of patient management. And if you have any questions and would like to discuss this topic further, feel free to contact me on LinkedIn or via mail, and I'd be happy to hear your thoughts. Thank you.
Thank you, Alina, for a very interesting presentation. Yeah. I want to ask you, are you providing on the app any additional information for the patients? You know, like how they behave during the treatment, how they should deal with the stress, what is the different stages of the IVF procedure, how they can cope with it? Yes, of course we do that because we want the best product for the patients. So we educate them. We educate them on the treatment processes. So how they need to deal with the whole process. We don't offer help on the feeling and psychology field, because this is something that needs to be done by a professional and not by an app. But what we do is we help them along the way, so they get every day their
plan and what they need to do. They can check out every medication they took in already. They see how they can see their plan, what comes next, once their egg retrieval, the transfer. They get all the information about all the results. So after the egg retrieval, they get the information how many eggs were retrieved, how many were fertilized the next day, and so on and so forth. So we take them by the hand and lead them through the whole process, so they don't they don't need to search via Google what means that and that. So this is what we do.
Again, thank you very much for a very, very interesting presentation.
Thank you.